Is it possible to perform MRI scan immediately after administering the iodine CT contrast? Yes, it's possible. Except when considering the renal complications. We have encountered numerous situations like this in duty. And we are curious about the underlying physics. Specifically, we would like to know, does iodine have any paramagnetic effect? Does it generate any signal on MRI? And does it cause any enhancement on MRI scans? Let's see the physics behind it. Iodine 127 has a nuclear spin of 5 by 2, which allows it to generate a signal. That means the MRI signal. However, the signals decays rapidly. As a result, while iodine can be detecting using a specialized laboratory nuclear magnetic resonance (NMR) spectrometer only, the conventional MRI system is not possible to detect the iodine signal. The fact is, the signal from the iodine is not typically captured by the standard MRI systems due to the rapid signal decay and frequency difference of the iodine, because iodine resonates at about 1 by 5 the rate of a proton of a hydrogen nucleus. So, you people that don't worry, there will not be iodine signal in the MRI images. Now, there will be one more question. Just think oppositely. Is it possible to perform a CT scan immediately after administering the gadolinium based MRI contrast? See, in our clinical practice, the situations often arise where the patients who have received MRI contrast need to undergo a CT scan. The questions are, does the presence of gadolinium affect the CT radiation attenuation? And does it cause any enhancement or artifact in CT images? The answer is yes, it's possible to do. But while gadolinium based MRI contrast agents are not typically designed for the CT imaging, everyone knows it. But there is a possibility of visualizing gadolinium enhancement in CT images under certain conditions. How and when it happens? If a large quantity of gadolinium based MRI contrast agent is administered to a patient at the time of performing CT scan, we all know usually the dose of the gadolinium is very less when comparing to the iodine contrast. Again, the physics, how it's happened. Gadolinium with an atomic number of 64 has a higher X-ray attenuation capacity compared to the iodine. Remember, the atomic number for the iodine is 54. So, gadolinium can attenuate more X-rays when compared to the iodine. Given gadolinium's higher atomic number compared to the iodine, one might expect a significant enhancement in CT images after gadolinium-based MRI contrast administration. However, the typical dose used for MRI are usually too small to produce noticeable enhancement in CT images. If larger quantities of gadolinium were administered, it's likely to have enhancement would be visible in CT images. Even at small doses, gadolinium can cause slight enhancement in CT images, particularly in the kidneys and bladder, where the contrast agent is concentrated. Just look whenever if you are doing like a scenario or situation. See, in the early days, like 90s, gadolinium-based contrast agents were occasionally used as the alternative for the CT scan patients with a history of iodine allergy. So, I think now you got the point. Is it possible to do CT scan contrast after MRI, MRI contrast after CT scan? I think you got the point. Just check whenever if you are a situation like this, keep it in your practical life. Thank you.